Hey, my name is Dr. Muhammad, aka the Tooth God, and I'm back with another video. In the last video, we discussed what are dental fillings and everything you need to know about that as a patient at home, or if you're just interested in dentistry. And today we're going to talk about the next elevation or the next progression to a dental filling, which is known as the root canal. So first of all, what is a root canal? You know, we like to talk about the definitions. Well, the root canal is actually an anatomical structure. It is simply the canals which travel within the roots of teeth. So the teeth that you see in the mouth, so these little white things that you see, that part is the crown of the tooth. But underneath the crown, buried underneath the gums and within the bone, are these roots that are within the tooth. And within those roots, they have these little canals or these little highways which carry your nerves and blood vessels and things of that nature to supply the tooth with life, feeling, and things of that nature. So whenever you have a cavity or an infection which spreads deep enough within the tooth and travels to a portion of the tooth known as the pulp chamber, it's like the heart of your tooth where all of your nerves and blood vessels sit, then it can actually connect to the little root portion of the tooth via the canal system. So the root canal system becomes infected. And so what we as dentists provide is something called root canal therapy. But for short, we simply say root canals. So that's why people call them root canals, even though everyone has root canals. You know, you just may not have had root canal therapy. The purpose of this root canal therapy is to remove the infection and fill the area. Now, unlike a regular filling, this is not just to fill for structural or integrity purposes. This is actually to cut off the connection of this infection so that the body can naturally heal itself. Because if you have the infection constantly providing bacterial load into that area, and it will travel underneath the tooth and actually infect the surrounding bone and blood vessels and ligament area underneath the actual roots of the tooth, and can actually travel throughout the rest of your body. I'm gonna pull up a little anatomy for you so you can see it a little bit better about a tooth. So here I have the cross section of a molar, and I want you to see the outermost layer starts as the enamel layer, and that enamel layer acts as like the armor of your tooth. Underneath there you have the dentin layer. That's where a lot of the cavities are filled when the infection spreads to there. But underneath that layer is where I'm talking about in the pulp region. That is the heart of your tooth. That portion of the tooth is mushy and connects to the rest of the tooth, as you can see within the diagram. So whenever that infection happens, what are some of the risks that you can get? You can get a toothache. Why? Well, because that's where the nerves sit. So nerves will allow you to feel things all throughout the body. And so when you have an infection deep into the nerve, you wake up with a toothache. The tooth also starts to die because the blood vessels supply vitality to a tooth. Just like if you cut off the circulation or the blood vessels to your foot can die on. Now for teeth, you know, a tooth that's dead doesn't mean a tooth that is worthless. We can still use the tooth functionally even without it being a vital tooth. And that's kind of what we're achieving with the root canal. If you allow that infection to stay, it can also spread so big that it makes the tooth so weak, it actually crumbles on you and it falls out. A lot of times when people talk about they bit into something and their tooth fell out, they're just talking about the crown region, and usually that signifies an infection was so deep in there that the tooth actually rots and falls out, and there's no point of doing root canal therapy. That's not the only way teeth can crack, but that's one of the more common ways that they do. And even more severe than that, anything related to your teeth, is because the infection is now in the heart of your tooth, which is connected to the bloodstream, you can actually have bacteria go and travel throughout your bloodstream and actually cause inflammation or infections of the heart valves. It's a condition known as endocarditis, and it is very serious. I've actually had a patient who had to be hospitalized because they needed a root canal. This is not something that you want to take lightly. You want to make sure that your teeth are nice and healthy, especially when the infection can connect to the rest of your teeth, like in the case of most root canals. What type of way that you'll know that you need a root canal is if you have a very severe toothache, you have sensitivity to hot, cold in an extreme manner, if you're chewing and you really can't chew on one side because it's extremely painful. One of the main signifiers is if this pain keeps you up at night. If you're noticing, you know, that type of situation, then most people know then at that point you at least need a root canal. Well, one of the main questions I typically get from patients about root canals is, do they hurt? So root canals in essence should not hurt, but because of the inflammation that can exist in such a significant infection, it can actually make the area much harder to get numb. So if you think about what we're talking about with the anatomy, underneath the root of the tooth where the crown sits, if that area gets infected where the nerves are under there and they start causing abscesses or cysts and things of that nature, then that area becomes so acidic that when the dentist puts in the numbing medication, it may not even take. And so you may require more numbing to get to the point to where you don't feel anything, but typically they should not hurt. You should be numb on all dental procedures during the procedure. Okay, now sometimes to also help the fact that the numbing may take a little bit better, a dentist may put you on antibiotics for a week or two to help try to calm down any type of bacterial infection like a cyst, or they may even put you on a little bit of a steroid dose to calm down the inflammation in the region. Now these aren't cures for the symptoms. Not like you can take antibiotics or a steroid pack and then be done with it. As long as that infection stays within the tooth, it will still recreate those symptoms unless you remove the infection. And so they're not curative, but they can calm down and alleviate that portion of things to make the root canal procedure go a little bit more smoothly. Another question that I get from a lot of patients is, do root canals always break on you? And root canals in essence are going to weaken your teeth, simply because in order for a dentist to fill the area, they have to access the area. So the dentist has to hollow out your tooth a little bit to remove the infected nerve tissue and blood vessel tissue. And when they do that, of course, just like anything that's more hollow than dense, it becomes weaker over time. And if you put too much force on a bite or something like that, it makes it more easy to crack the tooth. This is one of the main reasons why all root canals are crowned. They put a crown on top of the tooth to protect the weakened structure and insulate it from this type of damage. But they don't always have to crack on you. You just got to make sure that you keep the area clean, just like before, and to make sure that you don't have any type of destructive biting or anything else that needs to be addressed in terms of that, so that your teeth remain nice and strong. Root canals can last you forever, but in theory, if you get at least 15 years or so out of a tooth that got a root canal and crowned on it, that's considered pretty successful. And this is always beneficial because as humans, we are always in a race against time. The average life expectancy being anywhere between 70 and 80 and somewhere in that range, or if you live to be 100. And so if you can get a fifth of that taken care of without having to lose a tooth, it may not last forever, but at least 15 years is still considered a success. Another question I commonly get, or dentists are commonly asked, is there any post-op sensitivity? Well, this is a hard tissue surgery, so just like any type of surgical procedure, there's always a chance that you can have sensitivity. That's not always the reality for everyone, but it is fairly common. Now, this sensitivity should be like a mild to medium, in my opinion, and usually should last for a few weeks and constantly be getting better if the area has been healed. That's the thing you want to check on. Usually a dentist will give you some type of post-op medication, if not just some over-the-counter medications to try to deal with it if you have more mild symptoms. But I wouldn't anticipate anything severely sensitive. If you have some heightened sensitivity, which you don't believe is anywhere in that mild to medium range, or you don't see it improving within, let's say, a 6 to 8 week time frame, then I would definitely go consult with your dentist. Try to make sure that no nerve was missed, or that you don't have any other underlying issues that may be also causing pain in that root canal system, such as a destructive bite. Maybe you need to readjust that with some type of orthodontics. Maybe you have a crack in the tooth and that could have been missed, etc. There are things like that, but you want to just make sure that the symptoms are getting somewhat better over time and they're not back to that keeping you up at night type of standard. Do you need a crown? Yes. All root canals need a crown. Not all crowns need root canals, but all root canals need a crown. I'll explain that one a little later in the next video when we cover crowns. How to avoid root canals. Well, one of the main ways you can avoid a root canal is by getting routine dental checkups. I know that sounds pretty cliche, but the main reason is because if you have a smaller infection, which is in one of those areas I named before, the enamel or the dentin, then you can go ahead and get a filling. And in that filling, if you're able to remove the infection and keep it clean, then it won't spread into the root canal system. And that option is both less painful and much cheaper for you. And so if you're constantly going to the dentist and catching things early, just like most things with your health, then you avoid more severe treatments, just like a root canal, like that hard tissue surgery that's a little bit more invasive. And when you do it this way, you have a much less chance of tooth pain or toothaches or anything of the sort. So if you have a root canal appointment coming up, make sure you're calm and relaxed. You're not hungry. If you're on medication, take your medication and just be ready for a couple of hours to sit there. I've actually had a couple of root canals in my life when I was younger, and they're not that bad. You know, to me, the worst part is just the length of time, but you should not be feeling any pain. Like I said, that, you know, if you do feel any pain, make sure you let your dentist know so they can get you more numb. Sometimes with those really inflamed regions like we were talking about, they can be a little bit more difficult to numb, so you may just require a little extra numbing, which should not be too much of a problem, assuming that your blood pressure is within regular limits and things of that nature. And also try not to be super nervous. If you actually are nervous and elevate your own cortisol levels and stress levels, that can actually make the area a little bit more harder to deal with, and the inflammation appear more apparent and on the forefront of your brain. So try to make sure you're not super nervous and more relaxed. If you require like some type of oral sedative or nitrous gas, make sure you take advantage of that. I understand this is easier said than done, but just try your best, because it really should not be a horrible procedure or anything like that. You know, just be ready to relax for a couple hours. It may just be boring and the sounds could be off-putting to some people, but other than that, it shouldn't be too bad. Just kind of gave you a general gist and overview. Essentially, this therapy is to allow your body to fight off this infection and heal itself by first having the dentist clean out the system and block it off from future infection. If you have this area well taken care of and the bite is good and everything of that nature, you should be fine. That's the end of this video. Again, my name is Dr. Muhammad. In the next video, I'll be talking about what is a crown. Like, comment, subscribe. That always helps. If you want to, go check out that last video about what is a filling. I'm trying to do this series in order, talking about some of the more fundamental things and constantly getting a little bit deeper each video so that we can all be educated as a community and make better decisions. So that's the end of the video. Again, my name is Dr. Muhammad, and I'm out.